Ladies and gentlemen, it's a great pleasure for me to present the Hidden Hearts report produced by the Mary MacKillop Institute for Health Research at Australian Catholic University. The report is about cardiovascular risk and disease in Australian women. Why make a special report about women and cardiovascular disease or diseases affecting the heart, brain, and large blood vessels? Women are not simply smaller versions of men. Women are different. The natural history and profile of women with cardiovascular disease are typically different from men. Women have smaller hearts, smaller arteries, less typical coronary artery disease, and often more diffuse disease in very small arteries. Women with heart failure more often have a form that cannot be treated and has a high death risk, which is in contrast to the heart failure found more commonly in men, which has plenty of treatment opportunities. Women who have a heart attack may have more diffuse symptoms, which may delay diagnosis and treatment. Cardiovascular disease in women may be more difficult to diagnose, and also women may be less suitable for some of the treatments that suits men. In women, hormones, drugs, and electrolytes affect the heart and blood vessels differently to men. Women are more likely to display dose-related adverse drug reactions from medication due to smaller body size, higher body fat, different metabolism, and more kidney dysfunction. Yet, current management guidelines reflect a male bias due to poor representation of women in many clinical trials of new therapies. Therefore, we need more gender-specific research on cardiovascular disease that favors not only men, but both genders. As you all know, cardiovascular disease, or CVD, as it is more commonly known, are diseases affecting the heart and blood vessels. In the Hidden Hearts report, which has been provided to you in your summit folder, we focused on the most common CVDs in Australia, which are coronary artery disease, including heart attack, heart failure, and atrial fibrillation. Furthermore, we included two other major CVDs, which are stroke and peripheral artery disease, which involves blockages in the blood vessels of the legs and arms. And finally, some diseases that are linked to CVD, such as diabetes, Alzheimer's disease, dementia, and kidney failure, are also highlighted. All Australian women of all ages are at risk of CVD. This is a complex figure that shows the 20 leading causes of death in Australian women. The main point to take away from this is that 40% of these 20 leading causes of death that are shown in red in this figure are attributed to heart disease and stroke. This is in contrast to the cancers in blue, which represent 25% of this graph. In addition, these purple parts represent the CVD-related diseases, which are diabetes, Alzheimer's disease, dementia, and kidney failure. It is likely that the official figures that I showed to you on the previous slide underestimate the true contribution of CVD to all deaths in Australian women. Nevertheless, CVD is still the leading cause of death. Among these, heart attack is the most common in Australian women and is responsible for 24 deaths per day, and stroke is responsible for 18 deaths per day in Australian women. The primary objective of the Hidden Hearts report is to quantify the burden of CVD in Australian women. Secondary objectives are to identify key priorities for action, to raise awareness, and to make key recommendations for action. The key points in the report are Australia's aging female population the high risk factor levels, the estimates for the 5 most common forms of CVD among Australian women, and finally, the cost and future burden of CVD. As you can see, of course, this is a map of Australia outlining the number of hospital admissions for coronary artery disease, including heart attacks, by state in 2016. Overall in Australia, 20,500 women were admitted for a first coronary artery disease event, and that contributes to over 260,000 total admissions for coronary artery disease in the country. Sadly, as shown on the bottom line, 3,000 women per year died from a fatal cardiac event before they could even reach the hospital. Similarly, for heart failure, 14,000 women in the country will be admitted for the first heart failure event as part of 73,000 total hospital admissions for this disease this year. And then for atrial fibrillation, we estimate that as many as 19,000 women will be admitted to hospital with their first atrial fibrillation event this year, which contributes to over 120,000 total hospital admissions for atrial fibrillation. This slide outlines the number of hospitalizations for stroke per year. For stroke, we estimated that more than 11,000 women were admitted with their first stroke event this year, of a total of 90,000 stroke hospital admissions. And lastly, for peripheral artery disease, we estimated that 3,000 women will be admitted to hospital with the first event of this disease this year, after more than 30,000 total hospital admissions for this disease. And then we move to the costs of hospital care per year for cardiovascular disease in Australian women. A conservative estimate for the total costs of hospital care attributed to the 5 cardiovascular diseases covered in the Hidden Hearts report and mentioned here are in excess of 3 billion Australian dollars yearly. And I just want to stress the fact that this is just the cost for hospital care, whereas the total cost for cardiovascular diseases encompass much more than just hospital stay, of course. This slide demonstrates the possible increase in the number of hospitalized cases of cardiovascular disease in Australian women over the next 20 years. Based on projected population growth and aging alone, we anticipate the number of CVD-related hospitalizations in women to continue to rise over the next 2 decades. The increases in occurrence of cardiovascular disease imply an increasing need and cost of healthcare over the next years. In addition, the increasing rates of overweight and obesity in Australia may lead to more of the CVD risk factors, type 2 diabetes, high blood pressure, and high cholesterol. This risk factor increase may again be followed by increases in the incidence of new cases of cardiovascular disease above what that has been explained by population aging alone, unless effective prevention is implemented on both population and individual levels. Having said that, I would like to briefly comment on the very last topic that we have covered in the report, Hidden Hearts report, and that is the remarkably strong socioeconomic gradient that we find among Australian women for these diseases. We know from data provided by the AIHW that life expectancy for Australian Aboriginal and Torres Strait Islander women at birth is about 10 years shorter than for other Australian women. This is mainly caused by the Indigenous women's high risk of acute heart attack, which hits them much earlier. Some studies have shown that indigenous women have about 10 times higher rates of heart attack in the age group below 55 years compared to non-indigenous Australian women. Australian non-indigenous women on average get their first heart attack 10 years later than men. This sex advantage for non-indigenous women is absolutely wiped out in Australian indigenous females. Indigenous women have an exactly similar risk for heart attack, maybe even higher risk, as their male counterparts in the same age group. The advantage of being a woman when it comes to risk for cardiovascular disease does not exist at all among the indigenous Australian women. And this is not because of genetics or ethnicity. This serious situation is due to smoking, high blood pressure, cholesterol, and type 2 diabetes, which again is caused by unhealthy diet, inactivity, and obesity. And behind this lifestyle is a vulnerable population of women with serious issues that relates to lack of education as well. It's important to close the gap between indigenous and non-indigenous Australian women. It's a large population. What is more than good news, and very important for all Australian women to be aware of, is that previous research in Australia and overseas has revealed that more than 60% of all heart diseases can be prevented. This is because the diseases are mainly caused by factors related to lifestyle and treatable risk factors such as smoking, high blood pressure, high blood cholesterol, obesity, type 2 diabetes, and an unhealthy diet, comprised of high fat, sugar, and salt, and physical inactivity. And now to the final slide. So in conclusion, ladies and gentlemen, cardiovascular disease is a major health issue in Australian women. And based on the Hidden Hearts report, we have made the following recommendations. To conduct a raise awareness of CVD campaign all across the country, to do a definitive study of CVD risk and disease in Australia, to generate gender-specific guidelines relevant for women, and apply cost-effective prevention and management programs, and last but not least, support research on women and heart disease. Ladies and gentlemen, thank you for your attention.